We're really proud of what we've built here at Indiana State, and part of that is because of the people that came before us. Indiana State athletic training started here in 1969 with the first approved bachelor's degree program, and then in 1972 a post-professional program or graduate program. We have a really long history of firsts. We also have some early leaders that are minorities or women in the profession who really set the stage for what it meant for the tradition of excellence here at State. We are continuing their innovation. We're setting that high bar and ensuring quality in our profession. Today we're offering the only accredited doctorate in athletic training program, and we're doing it at the highest level.
This program is not for the slight of heart.
1, 2, 45-degree angle.
The program is 100% rigorous and intense.
So I lock this.
It was really difficult, hard, fast-paced.
Down and up to my right.
Pushes you beyond where you are comfortable.
This program is for people who are ready to elevate their game.
It's rigorous, it's tough, but it's very fair, very rewarding.
You are going to need to commit to working hard and being on your A game for the next 2 years of your life. It's not for people who are ready to just kind of lay down and get a degree. That's going to be a tough road for you.
So when we envisioned a doctorate in athletic training program, we thought about how to make future leaders, advanced practice leaders, people that were bosses in their environment. So we built a curriculum around advanced practice clinical skills, as well as the behaviors you want to see out of somebody leading other athletic trainers.
We're getting to absorb the knowledge in the classroom setting and then immediate application, like the next time we have patient interactions, to instill what we just learned.
It's very structured in the cohort setting. You're interacting with others constantly. You've got some people like myself who had just graduated from their professional degree, and then we've had people who have been practicing for 12, 13 years plus.
You really just get to learn from a lot of different viewpoints and gain a lot of experience from that you wouldn't get on your own.
One of the things that threw me was the big simulations that we do. We do these live simulations.
Usually they're mass casualty. So some of the ones we've done in the past have been the Boston bombing, bus crash, school shooter.
That was such a changing moment for me, kind of a pivot in the program for me, where I thought, oh man, like they're gonna push me.
Afterwards you kind of take a step back and you're like, wow, I definitely didn't do that right. Definitely did not do that one right. There's a little debrief about what went right, what went wrong.
A lot of times we are the first healthcare provider that these patients interact with, and we have the ability to provide care for a wide variety of conditions, and then also have the ability to understand when it's time to activate the rest of that healthcare team.
Our students are doing high-level manual therapy skills. They are learning how to teach emergency care skills. They are thinking about the patient, the whole patient, across the continuum of disease, from prevention all the way to return to activity.
In the past, this profession has been very rooted in athletics, and that means getting somebody back to sport. But this program really challenges that thinking.
Patient-centered care is really about looking at your patient as a whole person.
Yeah, tomorrow's game is important, but we need to think about next season, and then we need to think about after you graduate and what your next step is going to be. If we don't take the appropriate steps to manage this properly, how is that going to impact your life 20, 30 years from now?
We are treating a patient and not a team, and so we really need to focus on advocating for that patient as a person and as an individual in society.
I think our students leave here really proud of the accomplishments they've had, but what they're doing is leaving here as learners who will never stop. They are continually engaged in improving, and I think that's the kind of person we want to graduate from our program, because those are the people that keep pushing. They don't just finish and get that diploma. They continue to drive themselves and the people around them forward.
There's going to be a lot of firsts for you through this program, and that's okay. And you're going to be uncomfortable, and that's okay.
Once you come out on the other side, there's a tremendous amount of pride for sure. I'm halfway through, and I've got a lot of pride already.
The history and the tradition here, that's something that I have taken a lot of pride and value in.
I feel like this program is creating athletic trainers and professionals that are living up to the standards set by those before us.
Even though it's a small group relatively, the messages that are being received here are going to be disseminated far and wide.
What I'm most looking forward to is seeing how my peers are going to use those 3 letters after their name and advance the profession.
There was so much more to just the professional growth. There's been so many opportunities like for that personal growth as well.
The growth that you will get out of this program will be far beyond anything you ever expected or dreamed of. The people here are here and they're going to push you and help you grow into the true professional that you were meant to be.